Good morning. Today we are going to discuss about atrial septal defect. So what is atrial septal defect? What are the different types of atrial septal defect? And how do we diagnose an atrial septal defect using an echocardiography is what we are going to see in today's topic. First, we'll discuss about what is atrial septal defect. So our heart has four different chambers, the two upper chambers which are called as the atria and the two lower chambers which are called as the ventricles. The two upper chambers are divided by the interatrial septum and the two lower chambers are divided by the interventricular septum. So in atrial septal defect, there will be a hole in the interatrial septum. It is a congenital heart disease which occurs by birth. It is also called as the acyanotic heart disease. So what is acyanotic heart disease is that the blood shunts from the left side of the heart to the right side of the heart. That is, the oxygenated blood mixes with the deoxygenated blood. So when the defect is so small, the patient does not experience any symptoms. Some atrial septal defect flows during infancy or even when the child is growing. But some defect remains the same and the patient experiences the symptoms as the patient grows. So when the atrial septal defect is left untreated, what happens? It damages the lungs and the heart. So the only treatment for the atrial septal defect is surgical closure or the device closure. So in surgical closure, it is called as the patch closure and the device closure is called as the Asd Device Closure, which is done in the cardiac catheterization laboratory. So everyone have a look at this image. Let me explain the normal circulation of the heart first. So in normal circulation, the SVC and the IVC drains the deoxygenated blood into the right atrium, and from the right atrium the blood flows into the right ventricle through the tricuspid valve. From the right ventricle, the blood is carried out by the pulmonary arteries into the lungs for purification, and from the lungs the oxygenated blood is carried out by the pulmonary veins and it is drained into the left atrium. From the left atrium, the oxygenated blood is drained into the left ventricle through the mitral valve, and from the left ventricle it is carried out by the aorta and it is distributed to the whole part of the body. So this is the normal circulation of a human heart. But in case of atrial septal defect, since the defect is found in the interatrial septum, what happens? The blood, as usual, it flows from the SVC and the IVC into the right atrium, and from the right atrium it flows into the right ventricle through the tricuspid valve. From the right ventricle, it is carried out by the pulmonary artery and drained into the lungs for purification. After purification, the oxygenated blood is taken back from the pulmonary veins and it is drained into the left atrium. After reaching the left atrium, what happens? Since the left atrial pressure is high compared to the right atrial pressure and there is a hole in between the septum, so there occurs the shunting of blood. So the blood drains from the left atrium into the right atrium. So in case of atrial septal defect, the blood flows from the higher concentration area, that is the left atrium, into the lower concentration area, that is the right atrium. So this is called as the atrial septal defect. So the oxygenated blood drained by the pulmonary veins into the left atria is drained into the deoxygenated blood drained by the SVC and IVC. So the oxygenated blood mixes with the deoxygenated blood. So this is the concept of atrial septal defect. Let's discuss what are the symptoms of atrial septal defect. So as we have discussed earlier, many newborn babies with atrial septal defect have no symptom at the earliest, whereas the signs and symptoms prognosis as the patient enters into their adulthood. So what are the chief signs and symptoms of atrial septal defect? First, it is the shortness of breath. So patient will experience shortness of breath especially when exercising or exerting their heart. Second, it is the fatigue. So patient falls tired very easily. Third, it is the swelling of legs, feet or abdomen. So the patient will have ascites or pedal edema. Fourth, it is heart palpitation or skipped beats. So patient will have arrhythmias. And the fifth one is stroke. So what is the reason for this stroke? So for example, if the patient is having atrial fibrillation, what happens? The blood gets stagnated in one particular area, that is into the atria. So as the days goes by, the stagnated blood forms into a clot. So this clot dislodges from the left atria into the left ventricle through the mitral valve, and it enters into the aorta, which supplies the whole part of the body. So as the clot enters into the aorta and it reaches into the arch of aorta, it gets dislodged into the left common carotid and enters into the brain, causing stroke to the patient. So this is the reason for stroke in patients with atrial septal defect. The last one is heart murmur. So heart murmur, what is a heart murmur? Heart murmur is nothing but an abnormal heart sound. So when the doctor or a physician keep their stethoscope in the patient's chest, when they auscultate for the heart sound, they'll hear some abnormal heart sound. So there are two normal heart sound, S1 and S2. The abnormal heart sound starts from S3 and S4. So S3 and S4 is commonly called as the abnormal heart sound. So these are the symptoms of atrial septal defect. There are four different types of ASD, means there are four different types of atrial septal defect. So what are they? First, ostium secundum, second, ostium primum, third, sinus venosus, and fourth one is the coronary sinus. So what is ostium secundum? This is the most common type of ASD and occurs in the middle wall of the interatrial septum. Can you see here? So it occurs in between the walls of the interatrial septum. So this is the ostium secundum. Second is the ostium primum. So this defect occurs in the lower part of the atrial septum. So it occurs where the mitral valve and the tricuspid valve intersects. So this is the tricuspid valve and this is the mitral valve. So the place where the tricuspid and the mitral valve intersects, this defect occurs at this place. So this is called as the ostium primum ASD. Sinus venosus. So this defect occurs very rarely and it is found in the upper part of the atrial septum. It is also associated with other congenital heart problems. So last one is the coronary sinus. It is also a rare defect where in this defect the part of the wall between the coronary sinus, which is the part of the vein system of the heart, and the left atrium is missing. Now let us have a look at the complications. So what are the complications that has to be prevented by treating the disease at the earliest? First, it is the right-sided heart failure. So patient enters into the right-sided heart failure because of increased right atrial and ventricular volume overload and increased right atrial and ventricular pressure overload. Second, it is the abnormal heart rhythm, that is the arrhythmias. Third, patient will have increased risk of stroke, and finally patient will have shortened lifespan if this disease is left untreated. Last, let us now discuss about the less common serious complications of the atrial septal defect. So first, it is the pulmonary hypertension. The reason for pulmonary hypertension is since there is an increased volume overload and pressure overload in the right side chambers of the heart, it causes the increased volume and pressure overload in the pulmonary artery also, leading to the pulmonary hypertension. Finally, it is the Einstein-Menger syndrome. So what is an Einstein-Menger syndrome? In atrial septal defect, as we have discussed earlier, the blood shunts from the left atria into the right atria. That is, from the higher concentration area, the blood flows into the lower concentration area and the oxygenated blood mixes with the deoxygenated blood. But as the days goes by, what happens? There is an increased pressure and volume overload in the right atria and the right ventricle compared to the left atria. So the pressure increases in the right atria compared to the left atria, and so the blood shunts from the right side of the heart into the left side of the heart. So the main reason for the shunting is the increased pulmonary vascular resistance. So there will be an mixing of deoxygenated blood into the oxygenated blood. So the deoxygenated blood mixes with the oxygenated blood and there occurs a cyanosis. So the heart becomes a cyanotic heart disease. So this defect becomes a cyanotic heart disease. So this is called as the Einstein-Menger syndrome. These are the complications which has to be prevented. What are the various diagnostic tests performed to diagnose an atrial septal defect? First, it is the electrocardiography. In short, it is called as an ECG. Second, it is an echocardiography, which is a diagnostic test to identify an ASD. Third, it is the Asd device closure, which is performed in the cardiac catheterization laboratory. The major ECG criteria of an atrial septal defect is right axis deviation, right ventricular hypertrophy and RSR- pattern in B1. So in right axis deviation, the changes will be in lead 1 and in lead AVF. Also in lead AVL. So you will be able to see the negative QRS complex in lead 1 and a positive QRS complex in lead AVF. So this indicates the patient is having a right axis deviation. Next, right ventricular hypertrophy. So in right ventricular hypertrophy, what happens? There will be a tall R wave in lead V1, lead V2 and in lead V3. There will be an inverse reaction, that is there will be a deep S wave in lead V5 and in lead V6. So this indicates the patient is having a right ventricular hypertrophy. The last one is the RSR- pattern in lead V1. So RSR- pattern indicates nothing but the right bundle branch block. In right bundle branch block, what do you see is in V1 you'll have a M pattern, that is the RSR- pattern, and the W pattern in leads V5 and V6. So I think you'll be able to see in lead B2. Can you see something here? A notched wave. So this is called as the RSR- or the M pattern wave. So this indicates the patient is having an right bundle branch block. So all these three conditions indicates clearly that the patient is having an atrial septal defect. So after an ECG diagnosis, what we do is take the patient to the second stage of the diagnostic test, which is called as an echocardiography. So this echocardiography is the most important and the accurate diagnostic test for an atrial septal defect. So as we have seen earlier, what is an ASD is that it is the condition in which there is a branch in the continuity of the interatrial septum that creates a communication between the left atrium and the right atrium. So the blood flows from the high pressure area, that is from the left atrium, to the low pressure area, that is to the right atrium, which constitutes a left to right shunt, that is the oxygenated blood mixes with the deoxygenated blood, that causes the atrial septal defect. So first what we are going to see in echocardiography is the 2D echo. So using 2D echo, what are all the features we'll assess in an ASD. So first we'll be able to see the right sided chambers, that is the right atrium and the right ventricle will be dilated because of the increased venous flow, that is because of the increased blood flow. Oxygenated and the deoxygenated blood mixes, and this constitutes then increased venous return from the circulation as well as from the left atrium. So this constitutes the right ventricular volume overload. So because of this mixing of the oxygenated blood with the deoxygenated blood, it causes an increased volume overload in the right ventricle also. So in 2D echo, this is the apical 4-chamber view. Why it is called as an apical 4-chamber view is that all the 4 chambers of the heart will be visible in this view. So this is the right atrium, this is the right ventricle, this is the left atrium, and this will be the left ventricle. So can you see a shunting from the left atrium into the right atrium? So this is the ASD and it is found near the annulus of the tricuspid valve and the mitral valve. So this is the ostium primum ASD. So the shunting occurs from the left atrium to the right atrium. So it is also called as an echo dropout. So the place where the interatrial septum discontinuity is found, that is called as an echo dropout. There are two types of echo dropout. One is the false positive dropout and the other one is the true septal defect. In false positive dropout, the sonographer fails to hold the probe properly, or when the patient changes their position, then it will be an assumption for the sonographer whether the patient is having an ASD or not. So to identify whether the patient is having a true defect or a false defect, the following measures has to be taken. So what has to be done to differentiate? That is what we are going to see in this slide. If the patient is having a true septal defect, then the edges will be bright and thick, whereas if the patient is having a false defect, then the edges will be thin and they fade gradually. So this is how we find out whether the patient is having a true septal defect or a false positive dropout. The subcostal view is the best view to examine an interatrial septum compared to apical four-chamber view. In apical four-chamber view, sometimes the interatrial septum will be hidden, whereas in subcostal view, you will be able to differentiate whether the patient is having a false septal defect or it is a true septal defect. So the best view to examine an interatrial septum is the subcostal view. Second, transesophageal echo provides better and excellent visualization compared to the transthoracic echocardiography. So what you will see in this is there will be a significant volume overload of the right ventricle. So the right ventricle will be dilated beyond 23 mm. So the normal dimension of a right ventricle will be less than 23 mm. In case of atrial septal defect, due to increased volume overload, there will be an increased right ventricular dilatation beyond 23 mm, and there will be a paradoxical motion of the interventricular septum. So what is called as a paradoxical motion of interventricular septum is that the interventricular septum moves towards the left ventricle. So it will be in an S shape. So that is called as a paradoxical motion of the interventricular septum. So that's about the 2D echocardiography, and now we are moving to the Doppler echocardiography. So as of Doppler echocardiography, it is not that good modality to pick up an ASD because it is very poor in detecting low velocity, whereas only high velocity like severe ASD you'll be able to pick up easily in Doppler echocardiography. Only if there is a color flow mapping across the left to right, then you'll be able to detect it, that too in only minority of the cases. Majority of the cases, only in severe conditions you'll be able to pick the color flow mapping correctly. Then there will be an increased flow velocity across the tricuspid and the pulmonary valves, that too because of increased volume overload in the right atrium and the right ventricle. In ostium type of ASD, there will be an associated tricuspid regurgitation and mitral regurgitation. So endocardial cushion defect are associated with cleft leaflets of mitral and tricuspid valves. In this slide, you'll be able to see the defect, various defects. In the image 1, here is a defect, and also you can find a defect here. In image 2, can you see the shunting from right atrium to the left atrium? Also here. Then come to image 3. So you'll be able to see a shunt here, an ASD here, and the shunting occurs from here to here, that is from the left atrium to the right atrium. So these are the various types of atrial septal defect. Can you see a shunting that occurs from the left atrium to the right atrium? A blue color mosaic pattern. So this is the SVC type of shunting. In other words, it is called as the Sinus Venous Asd. So the shunting occurs from the left atrium to the right atrium. Also, can you see a hole here, mean a discontinuity in the interatrial septum? So this is an ostium primum type of ASD because it is found attached to the annulus of the tricuspid valve and the mitral valve. So this is the ostium primum type of ASD. Next, coming back to the ASD device closure. So what they do in an ASD device closure? The ASD device consists of two balloons and a waist. So this is the waist. Can you see here? So this is the waist which locks in between the septum, and the two balloons are the are attached both proximally and distally. So the balloon is taken across the defect into the left atrium, and it is deployed first proximally and then it is pulled back and it is deployed distally, so that the waist fits the interatrial septum and it blocks the discontinuity, so that it prevents the shunting from the left atrium to the right atrium like this. Can you see in image number 3? So this is how the atrial septal device closure works. This is another image depicting the device closure. So the first balloon is deployed and then it is pulled back, and the second balloon is deployed so that the waist sits and locks the interatrial septum, preventing the shunting from the left side to the right side. So this is the atrial septal defect device closure. Thank you.